So you may have been told by your optometrist or general practitioner that you are developing cataract changes in the eye and you might be a candidate for cataract surgery. What are we talking about? Inside the human eye is a structure called the lens, which helps us focus the light entering the eye. It sits behind the coloured iris and is clear when we're born. The lens assists to focus light on the retina at the back of the eye, specifically on the macula, which is where images are formed and signals sent to the brain and results in vision, or what we can see. Cataract is when the normally clear lens starts to become cloudy or darken. It's very common in our 70s and 80s, but can be an issue earlier than that. The usual cause of this change is easiest to think of in terms of sun and time and the cumulative effect of ultraviolet light exposure. The light over a long time causes changes in the cells of the lens and they degrade, causing a hardening, darkening and clouding of the lens. This generally happens very slowly and may not have any noticeable effect for some time until it reaches a point when it starts to cause visual symptoms. The big question for most people is, if I do have cataract, when do I need surgery? From my perspective as a surgeon, I only want to suggest surgery if I know it will improve my patient's vision. Modern cataract surgery has an excellent reputation for being safe, but there are some risks which need to be considered. Weighing the expected benefit against this risk to make sure it's in the patient's favour is important. One of the most reliable symptoms I find, which tells me a patient is likely to benefit from surgery, is when there's a sense of frustration with their vision and/or glasses. Either it feels like they're dirty all the time, or a newly updated set of glasses didn't help the vision as much as expected, or some people find the vision to be the same with or without glasses they previously found helpful. Needing extra light on the subject matter or glare symptoms, especially when driving at night, is common, and generally noting a drop in the clarity of distance or reading vision are all signs of cataract. Most cataract develops in both eyes together, so it is sometimes hard to compare between the two eyes, but often one eye will be a bit worse than the other. What is cataract surgery? We remove the now cloudy lens and replace this with a man-made, highly engineered intraocular lens. This new perfectly clear lens is carefully placed where the old lens used to be and focuses the light on the retina again. It sits inside the eye and will remain clear forever. Once cataract surgery has been done, it does not need to be repeated. The operation takes less than 30 minutes and you go home the same day. You are awake for the surgery, but given a twilight-type anaesthetic by an anaesthetist, which transforms the experience by removing your awareness, anxiety and worries about what is going on. You probably have friends or family who've had this surgery. The majority of people have good things to say about the experience and how it was much easier than they thought. If both eyes need surgery, which is common, the operations are separated by about 2 weeks. The timeline for surgery involves a preoperative consultation that includes tests to gather the necessary detailed information about your eyes, and most importantly, an examination and chat about you, your vision, and the surgery. If proceeding, we can plan the dates for your surgery and schedule the follow-up appointments, which occur in the 2 to 3 week period following the surgery. Recovery from the surgery is generally very quick and the improvements in vision rapid. By the next day, you'll be up and about. Discomfort is minor, mostly eye grittiness and being a bit light sensitive. Often you can resume driving within a few days if all is going well. We supply detailed instructions and advice after surgery, general do's and don'ts, and returning to your normal life and activities. That's a brief summary about cataract surgery. None of this material is a substitute for a personal face-to-face consultation or individual medical advice. It is certainly true that no two patients, or indeed two eyes, are exactly the same. And the way we see the world, or want to see the world, is different. You can think of these videos as aids to cover the basics, so if and when we do meet, we can focus on your concerns, questions and wishes. Thanks for listening.